New from us tonight, Alabama may not be getting as many of the monoclonal antibody treatments as other states. Those treatments have proven to be very effective at preventing the virus from getting worse. That's according to health experts.
Investigative reporter Brendan Kirby joining us with a look now at what that means for those in hopes of getting the treatment. Brendan.
Well, Anise, we can't put a hard number on it, but the state's top doctor said today that this could start affecting patients next week.
Monoclonal antibodies are an experimental treatment that has been increasingly popular over the last month. With healthcare providers ramping up treatments in the face of the latest COVID-19 wave, some were preparing for mass operations. But that's now changing. Alabama State Health Officer Dr. Scott Harris says the state is bracing for the impact of changes ordered by the White House. Those changes now require providers to submit requests to the health department, which in turn will request doses from the federal government. The federal government will base each state's allocation on its COVID case and hospitalization numbers. Dr. Harris says he's not sure how that formula will work precisely, but he expects Alabama to get less.
We really have some real unfortunate situations right now as the feds have sort of disrupted our distribution here with patients who are actually sick with COVID who were expecting to get it who aren't going to be able to access it.
The University of South Alabama Health System was even planning to have a monoclonal antibody treatment site up and running at the Civic Center by Monday, but a spokeswoman says that won't happen because of a lack of supply. Dr. Harris says the overall issue is a classic case of supply and demand. The nation produces about 150,000 monoclonal doses a week, with 6 or 7 states consuming 70 to 75% of it.
Virtually all here in the southeast, and of course we're states that have low vaccination rates, we have a high case rates, and so I think the use was appropriate. We were using it in people that needed to get it, but there's simply not enough to go around for everybody.
And this is also affecting a federal effort to expand these treatments. A federal contractor called KPMG was scouting 5 to 7 locations in Alabama and had plans to be up and running soon. But Dr. Harris says that it will be subject to these same limitations. Reporting live, Brendan Kirby, Fox 10 News.
Okay, Brendan, thank you. More of your COVID headlines coming up at the half hour. Stay with the Fox 10 News on air and online for the most comprehensive coronavirus coverage.